I practiced general optometry for a number of years in California and enjoyed that a lot. But as I got to thinking more about the root cause of a lot of people's visual and academic problems, I realized that there was more to it, and so I began taking extensive classes in vision therapy and visual enhancement at various locations throughout the country, and found that I could help people achieve their goals through, I guess you'd call non-traditional ways, through vision therapy, where we help people with their visual memory and their eye tracking. Vision, we often hear somebody is said to have 20/20 eyesight, and that is a test at 20 feet, seeing small letters, which is an excellent skill to have. But we don't read at 20 feet, and we don't. Our children don't do their academics mostly at 20 feet, although they need to see the board, and that's wonderful. But they need to be able to move their eyes accurately, point their eyes accurately. They need depth perception. They need to remember what they read. They need comprehension of what they read and retention. So 20/20 is just a small fraction of what's needed to be successful intellectually and academically. So we work on these other aspects extensively in vision enhancement and vision therapy. A few of them off the top of my head. When we read, our eyes have to converge on the reading material. They have to be able to accurately move from place to place, commonly called tracking. They need to, most importantly probably, we need to be able to understand what we read, not just see and say the words in our head. So we need to visually process what we read. And so this is the focus, if you'll pardon my pun, on what I do. Good. Stereo vision is very important. That's the ability of the right and left eye to work together, but I guess more importantly for the brain to interpret what the two eyes are putting into the brain. So in terms of what your question about balance and motor skills as it relates to reading and academics, children need to develop along a hierarchy from rolling over to lifting themselves, to crawling to walking, and getting their way around in the world. And if this is interrupted or doesn't happen in the right sequence, the two eyes may not function together as a team. So often in vision therapy we have to work on balance and right-left awareness to work up to the eyes working together in the stereo binocular vision. At Moscow Vision, we do visual exams, eye exams and visual exams, which encompass finding out if somebody's nearsighted, farsighted, has astigmatism, and then beyond that, some of the other issues we talked about, checking their depth perception, eye tracking. I do my workups here, so it's closely related to the learning clinic, because this is where we start in the analysis, which is the first step in helping somebody is diagnosing and the problem and coming up with a plan for treatment and vision therapy. For other people, they may just need contacts or glasses. What else? We often will find disease processes, particularly in aging people, such as cataracts and glaucoma, and either treat or refer those to the appropriate doctor to carry on from there. I fit all types of contacts. We fit soft, astigmatic, gas permeable, bifocal. These days it's a lot easier to test the waters in contacts. And years ago people had to make a big decision should they dive into it, but nowadays we have sampled trial lenses in their specific correction that we can put on them, and they could actually oftentimes wear them for a week and see if they like them. So there's not a large threshold, and I fit fairly young children too that sometimes do better visually with contacts than glasses. Gas permeable lenses is a rigid lens, and sometimes that works better for higher amounts of astigmatism. Also with certain types of gas permeable lenses, we can reshape the cornea. And this is the lens that the patient sleeps in and takes out during the daytime, corrects the vision in the way that LASIK does. It changes the shape of the cornea. However, unlike LASIK, it's not permanent, so you wear the lens as a retainer, sleeping in the lens. But it's good for people who aren't good candidates for surgery, younger people that aren't old enough to have it done, and people that just don't want surgery. It works well. It's called orthokeratology. Yeah, some people have higher amounts of visual correction needed that the soft lens, it's usually astigmatism. Some people have a condition called keratoconus, which requires a rigid lens. But we can fit the majority of patients with soft lenses. However, rigid gas permeable lenses are still a good option for a lot of people as a choice, because sometimes it'll help retain the eyes from getting worse. So if somebody has a progressive myopia, it might be a good choice to wear the rigid lens.
Yeah, they did well.
In the beginning, but people who get used to them find them very comfortable. And then if you switch them to soft, they'll say, I like the rigid ones better.
Right.
So it's an interesting thing that nobody likes them at the start though, whereas the soft ones are comfortable from the start.
Okay.
Well, we lived in California for a number of years and raised our adult sons who now have children. We have 5 grandchildren, but daughter who is now 7, and she was 4 when we moved here. So we thought it was the time in our lives that would be good to make a change. We liked the church here and school here, and thought it'd be a good place to raise our young daughter, and it seems to be the case. So we're enjoying Moscow. Well, I started, after the Air Force, I started my college at Santa Ana College in California, and then transferred to University of California at Santa Barbara, where I did my undergraduate work, and then Pacific University for optometry school. Well, as we were talking about vision therapy and what it can do for a patient, I saw a couple of boys. They happened to be identical twins, interestingly, and had the identical problem, which was they couldn't converge their vision to the reading distance. They had what's called convergence insufficiency, which means once they got closer than about 3 feet, they would see double. They couldn't put both eyes on the reading material or anything else that close. And subsequently, they did poorly academically. They were in the 2nd grade at the time and had been through extensive testing with psychologists and professional educators. And in the thick report, the comment was, in the vision report was, 20/20, no visual problem. Well, this was before they saw me, and I found that they had this eye tracking problem and convergence problem. And interestingly enough, the father had the same problem. And we worked with them in vision therapy to where they could converge to their nose, and went from having a diagnosis as an Asperger syndrome to being normal readers and normal in school. So the parents were very happy, and I was very gratified to see the good results of that. And that's a case of what we can do with vision therapy.
See you then. Thank you. Bye. Good morning, Moscow Vision Clinic.